patient decides that surgery is the preferred option, informed consent will be obtained on the day of the consultation. They will be asked to sign forms to enable us to track patients' outcomes. So essentially what I'll do is I will take information from patients in relation to emails and phone numbers to allow us to check on patients' baseline parameters, so how they are pain-wise, function-wise before surgery, and we'll signpost them towards an app called My Recovery app. Essentially, that app allows patients to prepare for surgery and enables them to understand what the condition is further to our consultation and prepare them even up to the day before surgery to the first few days and weeks after surgery. And they'll be signposted to physiotherapists and I will see them on the day of surgery.